Hello friends. Welcome back to my channel. Today I am going to talk about the zoonotic infections that affect our lungs or the pulmonary system. I will discuss briefly about the zoonotic infections and their importance in today's world. Zoonotic infections that affect our pulmonary system and various zoonotic infections of national and international concern. What is zoonosis? Broadly defined, zoonosis is an infectious disease that has jumped from animals to humans. Why is it important to be informed about zoonosis? Out of the 1,400 known human pathogens, roughly 800 are zoonotic. Out of the 180 emerging or re-emerging pathogens that have been documented in past 3 decades, 130 are zoonotic in origin. For zoonotic infections, initial jump is difficult, as was seen with H1N1 and HIV. Once established in humans, later transmission is maintained by human-to-human transmission. Newer pandemics are now being witnessed more frequently, and most of these are zoonotic in origin. For example, HIV, H1N1, SARS, and MERS. All of these are RNA viruses. Zoonotic infections jump from wildlife to first get established either in the peri-domestic wildlife, or livestock, or directly in humans, and then they get propagated in humans, livestock and peri-domestic wildlife, continuing the infections among humans. As an example, most of the coronaviruses have either bats or rodents as their natural hosts. In the first step, they get established in an intermediate host that is a peri-domestic animal like cow, camel, pig, llama, etc., and then gets transmitted to humans. To get established in humans, a zoonosis needs to complete the epidemiological triad of host, agent, and environment. Conditions should be conducive in all 3 domains for the zoonosis to get established among humans. Various animal reservoirs, vectors, environmental conditions, and host factors play a vital role in this process. We will now take a look at some common vectors that are very efficient vectors for zoonotic infections. First is the tick. The reason for its high efficiency as a vector is that tick has 4 life stages, and in order to jump from one life stage to the next, they require a blood meal. This blood meal is obtained from either animals or humans. In this process of blood meal, they acquire and transmit the infectious agent from animals to humans. Saliva of tick has anesthetic and inflammatory substances. It can feed for several days on host. This is the reason that many patients do not recall history of tick bite. Tick-borne zoonosis have a geographical distribution and seasonal variation. Ticks are removed manually using tweezers. Hold the tick close to the skin, pull perpendicular with constant pull with no twisting. Topical DEET application to skin and permethrin to close avoids tick exposure while working in fields. Another very efficient zoonosis vector is a mosquito. This is a list of infections caused by mosquitoes. Mosquitoes require blood meal for production of X, and in that process, they bite animals and humans both. This makes them highly efficient zoonosis vectors at global level. If we talk about host factors, there are a specific group of humans that are at high risk for zoonosis. They include agricultural workers, animal processing workers, outdoor enthusiasts, pet owners, and veterinarians. Many of the category A, B, and C bioterrorism agents are also zoonotic infections. This picture gives a list of such zoonotic infections that have been recognized as bioterrorism agents. Till now we were discussing zoonosis at a general level. Now let us focus on zoonosis affecting pulmonary system. Zoonotic infections can have varied presentations in lungs. First is acute respiratory distress syndrome and pulmonary edema. This can be caused by scrub typhus, leptospirosis, or hantavirus. It can also present with pneumonia that is seen with SARS, MERS, SARS-CoV-2 tularemia, plague, anthrax, psittacosis, Q fever, ehrlichiosis, brucellosis, and typhoid. And finally, zoonosis can manifest as hemoptysis. Various zoonotic infections presenting with hemoptysis include viral hemorrhagic fevers, paraganglioma, leptospirosis, plague, and Mycobacterium avium complex. We will cover some important infections in more detail. First is scrub typhus, for which the causative organism is Orientia-Tsutsugamoshi, which is a rickettsial agent. This infection is seen within this geographical area marked by this triangle called Tsutsugamoshi Triangle, bound by Afghanistan, Japan, and Australia. The agent for scrub typhus is a mite called Mushi mite. Once it acquires the rickettsial agent from either humans or animals, it can maintain the presence of rickettsia in subsequent generations of mites through transovarian transmission, and its progeny is naturally infected and ready to transmit the infection to the humans. The larval stage of the mite, also called a chigger, transmits the infection to the humans during the blood meal that is needed for its transformation to the next life stages. When the chigger bites a human, it leads to development of a lesion shown in this picture that is called an eschar. It resembles a burn mark, and that is why this name. Most common sites of eschar formation are the soft areas in the armpits, groin, under the breasts, back, arms, neck, where the skin is moist and soft for blood meal. The patient soon presents with development of eschar, fever, headache, myalgias, and conjunctival suffusion. If not diagnosed in time and without proper treatment, the scrub typhus patients can develop acute respiratory distress syndrome, encephalitis, acute kidney injury, and multi-organ dysfunction within a span of 5 to 6 days. Without treatment, the mortality in scrub typhus can be as high as 30%. Diagnosis is made clinically by examination and confirmed using ELISA. The gold standard test for diagnosis is, however, immunofluorescence assay. The treatment is doxycycline tablets 100 mg twice a day, given for 7 days. Alternative drugs include azithromycin and rifampicin. Another zoonotic infection that affects lungs is leptospirosis, caused by a spirochete, Leptospira interrogans. As seen in this map, the infection is mainly localized in the equatorial regions and is most prominent in coastal areas of these countries. Leptospirosis is also called Weil's disease. This spirochete is shed in the urine of infected rodents, dogs, cattle, or pigs. The urine gets mixed with the flood water in the coastal areas and is most prominent in the monsoons. The illness has a biphasic pattern of symptoms, starting with fever, headache, myalgias, conjunctival suffusion, rash, and jaundice. The symptoms resolve in 4 to 7 days. This is followed by a second phase that lasts for up to 4 weeks and manifests as acute respiratory distress syndrome, aseptic meningitis, uveitis, rash, shock, and acute kidney injury. Diagnosis is made by isolation of spirochetes by culture, ELISA, and microscopic agglutination test. And the treatment of mild illness includes amoxicillin or doxycycline, while severe illness requires injectable ceftriaxone, or penicillin. Leptospirosis pulmonary hemorrhage syndrome is also called Andaman hemorrhagic fever. It is reported predominantly from Andaman Islands, but sporadic cases have been seen in coastal Tamil Nadu and Gujarat. The patients present with massive hemoptysis after a short illness of 2 to 3 days and has a case fatality as high as 55 to 74%. Prompt diagnosis and treatment with injectable antibiotics can be life-saving. Next, we will discuss hantavirus pulmonary syndrome caused by hantavirus. Hantavirus can cause 2 predominant syndromes. First is hantavirus pulmonary syndrome, shown in green, and the second is hemorrhagic fever with renal syndrome, shown in purple. Hantavirus is excreted in the rat urine. The aerosols and droplets that contain rodent excretions, as well as contaminated food, rat bites, or scratches, can transmit this infection to humans. Human-to-human transmission is not known for this virus. It is also called New World hantavirus when it involves the lungs and presents as hantavirus pulmonary syndrome. The renal form is called Old World hantavirus that manifests as hemorrhagic fever with renal syndrome. It is an RNA virus with an incubation period of 2 to 3 weeks. The virus causes asymptomatic infection in rodents, but in humans, it causes nonspecific symptoms followed by explosive respiratory involvement in the form of acute respiratory distress syndrome or pulmonary edema. For its prevention, there is no vaccine, but intravenous ribavirin may be tried for its treatment. Despite best efforts, the case fatality for pulmonary syndrome may be 30 to 60%. Another important zoonotic infection involving lungs is tularemia. It is caused by a gram-negative Coccobacillus francisella tularensis. Distribution is worldwide and away from the tropics. It is also called rabbit fever because rabbits are intermediate hosts for this disease. Tularemia can be acquired in many ways, like inhalation of contaminated aerosols or agricultural dusts infected with rabbit feces, contact with infected animal, eating undercooked rabbit meat, drinking contaminated water, and even through bites by deer flies, ticks, and mosquitoes. Tularemia has 2 main clinical forms. First is the ulceroglandular form, seen in 80%. Second is glandular form. Third is typhoidal form, seen in 20%. Fourth is oculoglandular, and finally, pneumonic form that can be lethal. Patients develop fever, chills, cephalalgia, lymphadenopathy, and abdominal pain. They may also develop chest pain, breathlessness, hemoptysis, and respiratory failure. Because of its ease of transmission, it is an efficient bioterrorism agent. Diagnosis of tularemia is difficult and it poses risk to healthcare workers also. Treatment is injection streptomycin or gentamicin or ciprofloxacin or doxycycline or imipenem given for 10 to 21 days. Another dreaded zoonosis involving lungs is plague caused by a gram-negative coccobacillus called Yersinia pestis. It has global presence in some specific foci from which it re-emerges sporadically causing localized outbreaks. Plague has three forms: bubonic, septicemic, and pneumonic plague. Pneumonic plague spreads by droplet infection from one human to the other. It can be fatal, if untreated. Incubation period of plague can be few hours to few days. Patients present with headache, fever, weakness, and hemoptysis. Diagnosis is made through clinical suspicion, culture, rapid tests, PCR and ELISA. Treatment of plague is injectable streptomycin, doxycycline, or gentamicin. Vaccine is available but is recommended only for lab personnel working with Yersinia pestis. Moving on to another bioterrorism zoonotic agent, anthrax caused by a gram-positive bacillus called Bacillus anthracis. The anthrax bacteria are released from infected cattle in vegetative forms which on exposure to oxygen get converted into spores. These spores can be acquired by humans through ingestion, inhalation or through percutaneous route. Anthrax has an incubation period of 1 to 8 weeks. It is seen most commonly in the wool mills, slaughterhouses, and tanneries. Spores of anthrax have been used in a bioterrorism attack on U.S. citizens in 2001, also called Amerithrax, where letters containing anthrax spores were mailed to several news media offices, killing 5 people and infecting 17 others. Anthrax can be fatal if untreated. Inhalational anthrax has a prodromal period in the form of fever, chills, fatigue, cough, breathless, nausea, and vomiting. It is followed by the beginning of fulminant stage where patients develop altered mental status or breathlessness over next few days, bringing them to hospitals. Anthrax first infects lymph nodes and chest and then the lungs. Patients develop mediastinal lymphadenopathy, hemorrhagic mediastinitis, pleural effusion and breathlessness. In the second stage there is lung involvement and patients develop high fever, breathlessness, and shock. Death may occur within 48 hours of this without treatment. 55% survive with aggressive treatment with ciprofloxacin, doxycycline or amoxicillin. Anthrax does not spread from person to person. We must also know about ehrlichiosis and anaplasmosis, which are important zoonotic infections involving lungs. Ehrlichia genus includes gram-negative pleomorphic coccobacilli that infect leukocytes. The vectors are ticks that reside on white-tailed deer, dog or mice. Anaplasmosis is also tick-borne and is caused by the bacteria Anaplasma phagocytophilium. Both infections have similar clinical presentation, only geography differs for them. They present with fever, headache, nausea, vomiting, diarrhea, abdominal pain, rash and arthralgias. If untreated they result in renal failure, respiratory failure, encephalitis, leukocytopenia, thrombocytopenia, and transaminitis. Blood smear shows colonies of Ehrlichia in white blood cells in 20%. PCR is diagnostic and first weekend immunofluorescence assay is the gold standard test. Treatment is doxycycline given till 3 days after fever resolution. And finally, moving on to the last zoonotic disease that we will discuss today in this video. Paragonomyosis caused by a trematode that is acquired through contaminated food. This infection causes 22 million infections yearly. Once acquired, the adult worms develop in 2 to 3 months. The disease manifests as diarrhea, abdominal pain, fever, urticaria, hepatosplenomegaly, and eosinophilia. It involves lungs and presence with purulent and bloody effusions, cough with expectoration of eggs, pleurisy, and hemoptysis. Diagnosis is often confused with tuberculosis because of similar X-ray pictures. Always suspect paragonemus when acid-fast bacilli are not detected in sputum in the endemic regions for paragonemus infection. Presence of paragonemus eggs in sputum is diagnostic. Treatment of the infection is praziquantel. In the end, I want to emphasize importance of the wonder drug doxycycline in the treatment of most zoonotic lower respiratory tract infections that include anthrax, brucellosis, psittacosis, Q fever, pasteurellosis, plague, scrub typhus and leptospirosis. To conclude, all of us need to be aware of the possible zoonotic infections affecting respiratory system. Many of these newer zoonotic infections are RNA viruses. Emerging or re-emerging zoonotic infections can start epidemics and pandemics, especially if they involve lungs because of human-to-human transmission through aerosols. Travel and exposure history is important to narrow down a differential diagnosis. Doxycycline is a life-saving drug for most zoonotic infections, except viral infections. With it, we come to the end of this video on zoonotic infections involving respiratory system. I hope you liked the video. Like, subscribe, comment and share with your friends. Do not forget to press the bell icon to receive notification of all my subsequent videos. Thank you for your patient listening.